Welcome to this interview again in this series of Living from the Inside Out. And we're here with a special guest, Dr. Mellis.
Hello.
Dr. Mellis is an orthodontist in the Basking Ridge community. And we're going to start with how you discovered chiropractic.
So when I was pregnant with my second son, I was about 34 weeks and I went in for a routine ultrasound. And that pregnancy went very smoothly up until that point where my doctor alerted me to the fact that the baby was head up and was breech. So said that I would be destined for a C-section unless the baby was to turn on his own or turn by some sort of manipulation before my due date. And so, that definitely put a little anxiety in me because so far I had a really nice pregnancy and I had a normal delivery for my first baby who, everything seemed, like it should just kind of follow the same suit, but apparently babies do their own thing.
They certainly do. What were your expectations when you came to see me?
So my best friend told me that she had a very similar experience and she had a breech pregnancy and that she went to a chiropractor who did certain manipulations and that I had to do this because the last thing I wanted to do was have a C-section if I didn't need one. So at first I didn't really know how a chiropractor could manipulate and cause the baby to shift because the baby to me seemed like it's in the uterus, and what does that have to do with chiropractic?
And you had a lot of questions about that.
Oh yeah, I had a lot of questions about that, and I did a little research online and saw about the Webster technique, and I was all for doing anything that could cause this baby to turn before having to have a C-section. And I'm definitely big on holistic. If I could do anything to avoid any, invasive procedures. If I had to have a C-section, I had to have a C-section. Whatever the baby needed to be brought out healthy, but. Obviously, I would love to see Dr. Claps, and he would miraculously make this happen for me. So that was the game plan. And did it go that way? I wasn't sure because at, let's say, 37 weeks, they had recommended that if the baby hadn't turned, there's a procedure that they can do, which was a little risky because they could actually break the water and cause me to have an emergency C-section. And it's done in labor and delivery, where they manually try to turn the baby. And
did you go through that procedure?
And I did. At 37 weeks I did. Having seen you probably 3 visits before or 4 visits before, and then at 37 weeks, since the baby was still in the wrong position, I said, let me give it a shot. Went in there very nervous, not happy, having to have this procedure done. It was extremely painful. And it was all done under ultrasound.
This is the procedure that you had at Morristown.
At Morristown, not your procedure. Your procedure was very, very easy and not painful at all.
Let's
but
talk
at
about
Morristown,
that for a second.
Sure.
When you came in to see me for our technique, did we evaluate you and did we lay you on a table? And how was that? Was that comfortable for you?
It was absolutely comfortable, and of course you're always concerned being pregnant, like, am I allowed to be on my tummy? And Dr. Claps has a you have a breakaway table right. Where there's no pressure on the uterus at all. It's, your tummy hangs and the procedure's done on the back, then he turns you over and does some procedures on the uterine area and the musculature and the ligaments. So no, that procedure was very painless. It was the procedure where I went to the hospital and they tried to manually avert the baby, which was very scary, very painful, and absolutely didn't work because they do it under ultrasound. And the obstetrician that was doing the procedure said that the baby did not budge.
Okay.
The baby was, my pelvis was holding that baby's butt in place, and that baby did not want to turn, and it was very firm.
So let's talk a little bit about what is actually happening there.
Yeah.
And the uterus is like a balloon, and if for some reason when you see a balloon in a Macy's Day Parade, it has someone tethering the balloon so that it doesn't move from one direction to another. If the round ligament inside the uterus is so taut and tight that it actually prevents the baby from flipping around and going into the proper position, then it will stay stuck. So just by contacting that ligament, you're able to release the tension on it, and all of a sudden the baby's free to move around.
Yeah. And it sounded too good to be true. But a week after, I went for the manual version, which is done at a hospital because they know that the alternative, if they break your water, is going to be you get rushed into an emergency C-section. I went a week later, and they said the baby was still head up, breech, and that procedure obviously didn't work. So I said, nothing to lose. I'm going to just continue seeing Dr. Claps till the very end. My C-section was scheduled on a Tuesday, and I ended up just seeing Dr. Claps a couple more times. And on the Monday, the day before my C-section, I went in and that baby was in the right position.
Oh,
And I couldn't even believe it. You know, I had to see that ultrasound myself 10 times before I believed it. So the C-section was canceled, and then on Wednesday I had a beautiful baby boy who was born in the easiest delivery of all time, I think.
Yes. So the sweetest thing about this is, unexpected to you, the baby turned. It did what it needed to do.
He
We just needed to just get out of the way and allow that baby to go into the proper position, and the birth went smoothly.
Exactly. Exactly.
So would you actually say to women out there who have maybe a breech presentation that to try chiropractic?
Oh, absolutely, absolutely. You know, it's the alternative would have been a lot more recovery time and pain, and you know, I hear C-sections are, you know, a lot more difficult to recover from a delivery. So yeah, I'm so happy that I did it, and I'm so indebted to you. In fact, I joke that I need to, you know, throw in a middle name somewhere.
Yeah, it's perfectly fine to have a healthy child, and you are healthy as well.
Yeah.
That was the end game itself.
Thank you. I can't thank you enough.
Certainly welcome.
So when I ran into Dr. Clapps's office and said, "The baby turned,"
yes, it was
the greatest
moment.
thing.
It surely was.
And your staff was wonderful, and you know, the bedside manner couldn't be nicer, because I must have been a nervous wreck coming in to see you.
Yes, you were.
You know, deer in headlights. I'm going to have this C-section, aren't I? And the whole time you reassured me that I wasn't going to have to, which I felt was very, very neat.
Well, that's beautiful. I'm so grateful that you took the time to share your story with us today. And that is another story about living from the inside out with Dr. Millis. Thank you very much.
Thank you.